Hi everyone, it's Pippa from the Advantage Specialist Support Services for Girls and Women with ADHD. This is the third video on rejection sensitivity dysphoria. The first was talking about the nature of the beast, what it is, what it might feel like, what the consequences are. Second one was on things we can do for ourselves to reduce the impact of RSD on our lives. And this is the third one, which is about possible treatment for RSD. So the first treatment I'd like to talk about is CBT, Cognitive Behavioural Therapy. There is much clinical research that supports this as an effective therapy for people with ADHD, although I would say that if you're going to go down this route, it's really important that your therapist has an excellent understanding of the ADHD brain or is living with the condition themselves. I think if your therapist is unaware of the ADHD brain, I would be thinking that the impact of the intervention might not be as good. What CBT does is it challenges distorted thinking patterns, unhelpful thinking patterns that are maybe affecting your behaviour. It's not a quick fix by any means, and it does require you to do the work, if you like, and you may spend maybe 10-15 sessions working on it, but the outcomes can be quite literally transformative. So it is very, very much worthwhile exploring that as an option. So the type of thinking that is common in ADHD, which leads to more RSD, if you like, is kind of overgeneralization of things, catastrophizing. We are typically think we are mind reading abilities, and we know what other people are thinking, and we base conclusions on that without even asking them what are they thinking, for example, or what did they mean by. So CBT can really help you identify these thinking patterns and change them so you can get more sort of helpful behaviour as a result. We often are kind of all or nothing, aren't we? We often hugely magnify something or ridiculously minimize it. CBT will help you see things as they really are and accept them, process them, and move forwards. So that's CBT, highly recommended, but do make sure you get a therapist that understands the ADHD brain. The second line of treatment, if you like, for rejection sensitivity dysphoria are the non-stimulant medications available for the treatment of ADHD. So remember that in and of itself, RSD is not a diagnosis, so there are no nice guidelines on how to treat it. What we think is that RSD is an aspect of ADHD. It only seems to show up consistently in this group. So, and the other thing we know is that adults, women in particular, speak about this being the most kind of debilitating and challenging part of their condition. So it definitely does, warrant a treatment approach. So these non-stimulant medications for ADHD were not designed for ADHD. They were designed to reduce high blood pressure, but they're not very good at that. And some clever bod at some point realised that they delivered a benefit to people with ADHD. So their generic names are guanfacine and clonidine. They do have other brand names, but you need to know guanfacine and clonidine. They're the two generic terms. And they are available for the treatment of ADHD, but they are known as kind of off book or off license because they are being used to treat something that they were not designed for. But they have been prescribed for around 50 years to people with ADHD, so we know that A, they work, and B, there are no long-term side effects from them. Unlike stimulants, you have to take them for a number of days or even maybe a couple of weeks before you can appreciate the benefit of them, and you have to take them consistently to to keep that benefit you've taken consistently. Now we know that, say, guanfacine, we know that that works on about 30% of people with ADHD. So that's one of them, one non-stimulant, works well for 30% of people with ADHD on their rejection sensitivity dysphoria symptoms. We also know that another 30% of people with ADHD, that clonidine works very well on their experience or symptoms around RSD. So in total, that's 60% of people with ADHD can get a benefit around RSD on their symptoms overall. So you do need to be working with a clinician that is open to exploring this with you, someone that will be patient and will try things with you and work with you to establish if there has been a benefit, if the benefit is enough, and so on. There aren't any like huge downsides. It's not like you have to stop taking the stimulant to take this. Many people take the stimulant and the non-stimulant together. I do, and I think possibly this is the sweet spot, if you like. I know some people stimulants didn't work and non-stimulants do work. And obviously it's horses for courses, everybody's different, which is why you need very clear clinical supervision in moving forward with this. You may experience a bit of resistance, particularly if you're being treated under the NHS, because obviously these things cost money and your desire for them will take time from the service available. But I don't let that put you off. I just tell you that to kind of prepare you for what might come back at you. So for example, the clinician might say, oh, well, these are not licensed, so I'm not doing it. If you know your facts, you know that they have been prescribed for over 50 years for this, that they are in America, I think in the UK as well, I think they are licensed for, or they're recommended for the treatment of ADHD in children. So clearly they are appropriate because they work in children and they're going to work on you too. And it's probably better that way around, isn't it? If children can tolerate them, then obviously adults should be as well. We know that, like I said, that there are no long-term side effects, and they're not going to damage you if you do try them and they don't work. And when they do work, people describe it as putting on emotional armour. It can be that good, guys. It can be that good. So definitely worth exploring. The effect from them is the desired effect, if you like, what you're aiming for is a more sort of peaceful, calm experience more of the time, as opposed to it's amazing, it's a disaster, like you're more even. You should feel kind of quite sort of comfortable in your own skin. You should not feel sedated or in any way slowed down. If that's happening, they're not right for you. We do know that that there are some side effects, of course there are with everything, and probably if you read the whole leaflet again, terrifying, just like the paracetamol leaflet, by the way. But overall, I would say things to watch out for would be headaches, would be drowsiness, and dry mouth, actually. But quite often these side effects do wear off, in a matter of weeks. So if you could bear with it, you might find that the side effects do wear off. We're not exactly sure how they work or why they work, let's say. We assume that they in some way sort of turn down the adrenaline in the nervous system, but we're not exactly sure. So that is the sort of pharmacological approach to ADHD, which can really help RSD symptoms. But before I sign off, I want to give the last word on this to my ADHD crush, Ned Halliwell. Ned Halliwell has been working in the field of ADHD for decades, has ADHD himself, is an incredible advocate for us. He says that he hopes in his lifetime he might see that people are seeking a diagnosis of ADHD as a positive thing. You know, like people will want to have ADHD because of all the great benefits that it delivers. So obviously, I hope he achieves his goal. But one of the things that he's been kind of working on recently and advocating for is a change of name. So attention deficit hyperactivity disorder isn't a great name, is it? And also, it's not a very accurate name for my money either. I don't have a deficit of attention. In a way, I have like too much attention. I'm paying attention to bloody everything all of the time, and that's why ADHD can make things difficult for me. To call it a disorder, I really don't think it's a disorder. Honestly, it's a difference, absolutely, but it's only a disorder because I have to operate in the neurotypical brained world. In all the systems and things that make them look good. So that's why if I am disordered, it's because I'm made to do things their way. Anyway, his new name for ADHD is it's called VAST, which I love, and that stands for Variable Attention Stimulus Trait. I know it's a mouthful, just like ADHD is a mouthful, but I think variable attention much more describes my experience, and the fact that it's a trait, not a disorder, I also appreciate as well. But when he's writing about this, he points to the fact that with ADHD, so many things come in pairs, and there's kind of like a sort of positive or negative, like a seesaw going up and down. And he's saying, like, you know, on the one hand, we've got like hyper focus where we're like all over it, can't put it down, to, oh my gosh, I can't do this. It's like walking through treacle. I can't concentrate at all. We've got the idea of being like curious and creative and imaginative on the one hand, and then the idea of being so distractible, even distracting yourself with your own thoughts kind of thing. And he says it's the same for rejection sensitivity dysphoria. That is one side of the coin, definitely. And yes, it can be debilitating, but I love this. He says, on the other hand, there is something that he calls recognition responsive euphoria. So that is when we literally are basking in the praise and encouragement and cheerleading of those around us, that when we get that praise, we are lit up and we are super motivated. It's like any sort of positivity or encouragement kind of like supercharges us forward to be hopefully our awesome selves. For us, even sometimes like a drop of praise can generate a kind of tsunami of energy and creativity and problem solving, and we can be incredibly motivated. I would say this will probably only happen if you surround yourself with the right people. So that's probably something to think about. Our environment is crucial. I mentioned this in the video about what things we could do for ourselves. So I think this is really important because I'm saying it twice. Think about your environment, in particular the people that populate that environment. They can either lift you up or they can crush you. So make sure you choose to be around those that lift you. Thanks very much for your attention. I will see you soon.